Okay, so let's go deep on this one because this is going to help a lot of people who
Yeah.
maybe have hernias, maybe have pain and don't know they've got a hernia yet. So if we go way back, let's look at me with pain around 7 years of age. So I couldn't do
Wow.
anything at all without feeling pain. Surfing, running, playing soccer, football, whatever.
At
And
7, you're saying? As like
yeah,
a
that's
child?
7 years of age, yeah. But it was not 10 out of 10 pain. It was probably a 4 or 5. But because I always had it, when it was stronger, I just thought it was part and parcel of playing a sport because it only came when I was playing sport or not long after. And at that young age, I felt pain. At that young age, for me to feel pain, there must have been dysfunction. You do not feel pain without a good reason for causing pain. Yeah, the brain's very intelligent.
Welcome to Bed, Back, and Beyond, sharing positive stories of recovery from serious back or neck injury. Your host is CK, a fellow champion who draws on her own experience with herniated disc surgery. Join her as she talks with others who have overcome the physical and emotional trauma of a painful injury, and discover for yourself how you can find hope and encouragement in recovery.
Welcome to this episode of Bed, Back, and Beyond. On today's episode, I am joined by Jason Gilbert. He is a chiropractor and a fellow herniated disc patient. He has dedicated 30 years of his life on helping people to overcome their spinal problems. Hi, Jason. Thank you so much for joining me on the Bed, Back, and Beyond podcast. Before we dive into your back journey, how about you tell us a little bit about yourself?
Hey, Christine. Thank you very much for inviting me to talk about a topic that I'm very passionate about. So I really appreciate that. My background, I am Australian, but I lived 20 years of my life in Latin America. I went there after graduating from chiropractic school for a surf trip. And it always fascinated me to visit places where chiropractic was unknown. And I did a full lap of Latin America for a year in Central America, and ended up opening up a clinic in Lima, Peru, of all places. And that was because I'm a surfer also, and I can surf and work, and had the beautiful opportunity to be able to go up to the Andes and see my busiest day, 220 people, but on average, when I go, there'd be 150 people a day, and go to a place called Iquitos in the Amazon and do the same thing. So for me, experience-wise, it was beautiful, and it formed a large part of who I am today, 20 years there. I could tell you also that I'm passionate about health. Our family owned a health food store when I was young, and I worked there on the weekend. So you can imagine how many amazing people I met and inspiring people. And I, for some reason, from a very young age, was fascinated by, I guess, the fact that our body could function incorrectly without us knowing it. And that was we had like health lessons at school just for 6 months. But I remember way back and seeing an artery full of atherosclerosis and thinking, hang on, we don't always know when we've got that. Like that was always in my mind about being motivated by function and not by symptoms, not waiting till symptoms arrive. And we'll talk about that in my story, I'm sure, as far as my back problem and disc hernia and all the rest. But that they were the two things really that influenced me a lot: the health food store, health, surfing, sport, and the desire to travel, which took me to Peru.
What was it like introducing chiropractics in a country that really had never heard of it before?
It was incredible because chiropractic's just a word, isn't it, when you think about it? And so an unknown word to someone who's never experienced it before, it's more the concept that you explain. And so for me, it was beautiful because I don't necessarily agree with the way certain associations, chiropractic associations have, not published, I guess, promoted themselves in their countries and the way they've dealt with chiropractic and educating the public on that. So being a pioneer in Peru and the founding member of the Peruvian Association, that was a beautiful opportunity to have people understand, I guess, what the whole concept of philosophy of chiropractic was, as opposed to, a university written definition. And it was a beautiful opportunity. Also, around that time, I got invited to Brazil to help start the first chiropractic program in Latin America.
Wow.
So I was very involved with chiropractic as a founder in Latin America. And funny enough, in Peru, from Inca times, they had what they call hueseros. So hueso is bone, and huesero is someone who deals with bone. So
Oh.
they were already very open to that concept.
Oh, wow.
And I'd rock up to certain towns with my plastic spine and a portable treatment table, and I'd find a place at hospitals, sometimes schools, Lions clubs, and always local radio and television. And people they'd get the concept. So that's what I'm saying in life. Sometimes I notice myself, I go back home, just because I graduated as a chiropractor 25 years ago, doesn't mean that, my depth, my paradigm hasn't changed a bit. And that
Right.
was a beautiful thing, actually explaining that to people, why the spine loses function,
Yeah.
and it does it without us feeling pain. And so it was a beautiful learning ground as well, because you can imagine how many people I was treating over there. And in our clinic in Lima, we had an X-ray machine, and almost everybody got X-rayed. Okay.
Mhm.
So it was a huge learning experience to be able to show someone where their pain was and where certain problems in their spine were. And often when they do full spinal X-rays, but maybe only come in with a neck, dorsal, or a lumbar problem, we'd find severe and advanced problems, degeneration in other areas where they'd never felt pain.
Wow.
So it was just, for me, the most beautiful place to truly learn about health, spinal health, and I guess the practical side as well in delivering an adjustment.
Was there something in particular that drew you to chiropractics in the first place?
Great question. When I finished school, I didn't know what I wanted to do. I was always science orientated at school, so I enrolled for a Bachelor of Medical Science degree.
Mhm.
And in the health food store one morning, I was studying, and a guy came in. He said, "What are you doing?" I said, "Oh, I'm studying for Bachelor of Medical Science." He said, "What are you going to do with that?" And I said, "I never thought about it." He said, "You're going to work for the pharmaceutical industry or something like that." And I was like, "Oh, okay." Didn't really know the implications of that either back then. When he asked what I was doing, and I explained that, he said, "You should study chiropractic." I just went to a chiropractor. I was, like hobbling in there. I needed help actually to get in. I was with him for 5 minutes. I paid $50, and now I'm pain free and I can walk. Be like, "Yeah, what machine?
Yeah.
What machine did he use?" "No, just use his hands." So that was really the first thing. And around that same week, this whole thing in life, nothing's a coincidence.
Mhm.
Around that same time, I was surfing, and a world champion at the time, an Australian world champion, Tom Carroll, was surfing as well. And I was complaining about back pain, because I'd had back pain from a very young age, but I just accepted it as normal. And
Right.
so it got to the point around that age, 18, 19 years of age, that it stopped me in my tracks. And he recommended that I go to a chiropractor. So those two things in that 1 week, me going to the chiropractor, getting an adjustment or a couple of adjustments, and feeling how my body responded, that was it. I
Yeah,
wanted to say.
things just often fall into place, don't they?
It really is amazing. I was
Yeah.
talking to somebody today about that, about how blessed I feel, because she was talking about her daughter, and her daughter's 19 and studying drama. She feels that she doesn't know what to do. And I was just thinking, I'm just so lucky that I found that. Or sometimes they say it finds you, and I
Mhm.
believe that. That was my life purpose, and I know that. And I'm just so grateful. It doesn't even feel like work.
Yeah, that's amazing. Now,
Yeah.
unfortunately, you got to experience the herniated disc side of life, is that correct?
Yes.
Oh, when did that happen for you?
Okay, so let's go deep on this one, because this is going to help a lot of people who
Yeah.
maybe have hernias, maybe
Mhm.
have pain and don't know they've got a hernia yet, and maybe are looking at surgery. I think it's so important to understand how these things evolve. So if we go way back, let's look at me with pain around 7 years of age. So I
Mhm.
couldn't do
Wow.
anything at all without feeling pain. Surfing, running, playing soccer, football, whatever.
At
And
7, you're saying? As, like,
yeah,
a
about
child?
7 years of age, yeah. But it was not 10 out of 10 pain. It was probably a 4 or 5. But because I always had it, when it was stronger, I just thought it was part and parcel of playing a sport,
Mhm.
because it only came when I was playing sport, or not long after. Sorry, whoops. And so why am I saying this? At that young age, I felt pain. At that young age, for me to feel pain, there must have been dysfunction. You do not feel pain without a good reason for causing pain. Yeah, the brain's very intelligent. So as I said, I was a runner, and I later on found out I had a discrepancy in my leg length. My
Okay.
right leg was shorter than the left. What else? I played football, rugby league. I had this silly habit of jumping off the balcony on the first floor. So
Mhm.
obviously I'd caused dysfunction. And I explain this the same way that a car wheel goes over a bump or a hole and misaligns the wheel. Okay, we
Right.
won't feel it at the time. Sometimes we think, how have I still got air in the tire? How did the tire not burst? But yeah, okay, cool. Still driving along, all good. But we know that the wheel's misaligned. And we know that if it is misaligned and you drive that car for 10,000, 20,000 miles more, it will wear out the tire.
Right.
The disc problems for me are very clear, not only because of my experience, but ironically, my specialty in Brazil was receiving people from orthopedic surgeons and neurologists when they knew that it wasn't surgical, but the
Mhm.
clients had done, their patients had done everything, and they thought they'll just try one more thing, and they'd heard about some Australian guy that does stuff. So, it was literally like that. I didn't personally meet any of them. They'd write notes now and then, but it was all via my clients who'd gone back to them and told them.
Mhm.
You can imagine over the years, I just joined the dots and realized that it's not a one-off thing. You don't get a hernia from falling on your bottom once. Hernia is like that. The tire on the wheel of the car, it wears out. The disc wears out gradually.
Yeah.
So this is my process to 18. There was a crisis. Okay. I still didn't have referred pain down the leg.
Okay.
And then I guess years and years, even though I was doing chiropractic, years of lifting my patients up. I had this terrible habit after an adjustment, a dorsal adjustment, I'd actually lift them from the same side of the table.
Mhm.
And kite surfing, other sports. And I actually truly believe what really threw me over the edge was I was doing very strong therapy, chelation therapy to remove mercury from my body. I
Okay.
didn't do it correctly, and I know I would have lost a lot of minerals. So quite possibly the integrity of my disc was okay until I was just leaching myself of minerals. And then,
Okay.
well, all it takes is the straw that breaks the camel's back, and the disc hernia came out.
And when was that? What year?
That was 12 years ago now.
Okay. And it was so bad that you needed surgery?
Yes.
Oh.
So that was interesting. Look, we look back on our lives and we look at unpleasant moments and we see how we learn from them.
Mhm.
Over the years, I've literally treated hundreds of people for failed back surgery.
Mhm.
Okay, now I actually don't like that terminology. It's too easy to blame the surgery. Most times, people don't know what to do post surgery. I'm
Right.
not saying that all surgeries are 100%, but what I'm saying is that lets people think that it failed. It didn't fail. It's just that people and the doctors failed to look at the original cause.
Okay.
Not worth changing the tire on the wheel, on the wheel of the car, unless you realign the wheel. And
Right.
most people, when they do disc surgery, okay, it's like putting a new tire on, but that original dysfunction is never looked at.
Okay.
And post surgery, I realized that even more. We are in great need of knowing what to do after surgery. So my experience was interesting because it was humbling. For years, I'd looked at that scar and gone, oh, another one that's unnecessary. For example, L45, L5S1, they're the most common lumbar segments to operate.
Mhm.
Almost always, not always, but almost always, I'd palpate adjacent to that area and palpate the sacroiliac joint and
Mhm.
say, does it hurt here? Yeah, yeah, that's my pain. Was this your pain before surgery? Yes. Did
Mm.
anyone ever palpate that joint? No. Because what happens is when the sacroiliac joints are subluxated, when they're compromised in their function, that overloads the disc. Because it can't distribute the load equally between the other sacroiliac joint and the L5S1 or L4, L5 disc. So with time, that original cause leads to the wear and tear.
Yeah.
And I know that that's a long-winded explanation, but basically for me, I resisted it so much because I thought this is impossible. How can it be after seeing my MRI? How
Mhm.
can it be that I've got the worst case I've ever seen?
Yeah.
And how is it that I've helped so many people in my life, but my case is surgical?
Right.
It was
I can't imagine how frustrating that is as a practitioner.
Yeah, it was difficult. It was humbling. And it was funny because I resisted it. I did
Mhm.
everything you can imagine.
Yeah.
Did acupuncture, I got adjusted, did my physio, went back to yoga. No, I couldn't do yoga. I tried, but it was too painful. Did spiritual surgery, as they call it in Brazil. I went to a healer, John of God. Like, I did everything possible. Flew to the States.
That's how bad the pain is. You want to try everything.
Honestly, it was a 9 or 10 out of 10 pain, and I had that for 2 months.
Wow.
Yeah. I mean, 80 and 90-year-old men and women could walk faster than I could
Yeah.
on the street. So in that time, you can imagine how I've never been depressed, thank God. But that was the closest I'd ever been to understanding depression.
Yeah.
You know,
it's a very emotional experience.
Very emotional.
Mm-hmm.
However, when I accepted that it was surgical and it was humbling, and I was like, okay, you know, like, I embraced the idea, and I thought, you know what? Yeah, there are cases that are most definitely surgical.
Mm-hmm.
You can't put everyone in the same group and say, yeah, it's not surgical. A lot are. Many doctors these days are realizing that as well. Many doctors don't want to operate. You'll hear that. It's just that if their client or their patient's in pain and they've done everything, what's left?
Right. Surgery.
Yeah, exactly. Yeah.
Did you go back to Australia for surgery, or?
I did because, well, I was living in Brazil. I did have a health fund in Brazil. We're talking about your spinal cord and possible ramifications after surgery if that's not correctly done. So I went back to Australia. Also in Australia, we have Medicare. So we have government-funded medicine.
Right.
And not that I actually still paid, but I actually found a chiropractor, a guy who graduated as a chiropractor and realized that if he continued in that job, he would ruin his back. That was his motive for leaving chiropractic, studying medicine, studying orthopedic surgery, and he graduated from the Royal Academy of Orthopedic Surgeons.
Okay.
So I wanted a surgeon, who would appreciate the intricacies of the neurological side, the nervous system, when operating, because I had seen a lot over the years, more with orthopedic surgeons than neurologists, where that was not considered. Okay, so it was really important that person was going to really focus on that for me.
And in Australia, you said it's government funded healthcare, right?
Taxpayer funded, taxpayer funded, yeah.
So is it difficult to get a surgery in a timely manner, or?
So, yeah, what that is, so I had health insurance, private as well, and that just meant that a lot of things that I would have had to have paid for was taxpayer funded, like part of Medicare.
Okay.
So in the end, let's say this surgery would have cost, let's say, $10,000 back then. Now it's probably a lot more. Ended up costing me $2,500. You know, and one of the saddest things I see, and I know someone who's really close to me right now going through this, she doesn't have health insurance. So not only has she been in excruciating pain for a long time, but she has to go through the public system, meaning that you've got no choice most of the time, the doctor. In the end, she'll choose someone, but most, in Australia at least, when you go through the public system, a doctor, a specialist, will oversee the surgery performed by interns. And when it's your time, you're just thinking, oh, maybe I'd like to have my own surgery.
Yeah. So then once you had your surgery, how long was your recovery? Couple weeks, couple months? How long did it take you to get back to feeling?
That's an interesting one, because this same surgery, it's a microdiscectomy of L5S1.
Yes.
Where you probably know that procedure, where they drill through the lamina laparoscopically, and they have a little look around and they pull the disc material away. Now, in my case, Christine, on the MRI, 90% of the spinal canal was obliterated by the disc material, and 1 centimeter had migrated towards the head, 9 millimeters towards my feet.
Wow.
So it was well and truly wedged.
Right.
My saving grace was that I had quite large lumbar discs, because some people have congenitally smaller and thinner discs. So when, they did the surgery, I went for a comparative MRI about a year later, and they said, oh, the hernia's gone. They couldn't see that surgery had been done. It wasn't there, yeah. So the recovery was, my recovery, I didn't take any pain medication after it.
Wow.
Okay? No. you could feel that, something had happened down there,
Yeah.
a little bit stiff, obviously where
Mhm.
the incision and some of the and a potential fibrosity in the future if I didn't work with that
Mhm.
was. But I started walking. Actually, to tell you the truth, I was walking a lot, even though I was in pain before it. I wanted to maintain biomechanical function.
Right.
Right? A lot of people go to bed, stay in bed.
Yep.
Problem is, they're going to have to pay for that after surgery. Okay. You know what I'm talking about? Yeah. So
Yep.
I decided that in spite of the pain, I'd just get on with life and I'd move, even though it was slow,
Yeah.
because I knew that that was all good prep for the surgery. I also specialize in functional health.
Mhm.
I'm very aware of diet, inflammatory foods, the right sort of supplements,
Right.
and made sure that was all okay. So I'm sure that helped my recovery, of course. But within, so my surgery, I was overnight in hospital. The next day, all I had to do to save $1,000, because there's $1,000 a night, all I
Yeah.
had to do is have a bowel motion.
Yeah. Mhm.
Ask mum to bring some prunes and some other stuff in
That's the same here.
to the hospital, yeah, and then
Yeah.
I was away. So we walked back to the hotel, and then maybe the next day we flew back to Sydney because this was in Melbourne. So on day 3, I was walking 2-3 hours, and
Wow.
in a week, I was walking 6 hours a day,
Wow.
okay? Because
That's amazing.
yeah, no load, following, doctor's orders on that one, but
Yeah.
I just knew how important it was to get that spine moving again, to disencourage any possibility of those intrinsic muscles, intervertebral muscles tightening, reflexly guarding that area.
Right.
And I was very cautious, very, very
Yeah.
cautious. I walked a lot for months. I think this is interesting advice that I received, but I work with the World Surfing League in the medical team, and one of our chiropractors actually gave me advice to get onto a stand-up paddleboard, which was about 3 months down after, 3 or
Sure.
4.
Yeah.
And because not to catch waves, but it fires up the proprioceptors. So a
Okay.
lot of people, when they've had injuries, common ones in the ankle, but it also happens in the spine, they lose that neurological network or the connection that fires up the proprioceptors that
Mhm.
let our brain know where our body is in space. So
Okay.
I was doing that, and that was very helpful. These days, I work with technology called the power plate. It's whole body vibration with my post-surgical clients, and
Mhm.
it's just a very light vibration because I want to get everything that's related to balance and equilibrium fired up.
Mhm.
And like I was surfing within, I guess, doing yoga and surfing 5 or 6 months later.
Wow.
There are people that do that a month later.
That's that's amazing.
I
So
know, but
in
I'm just saying, too fast. You know
yes.
what I mean? Like, it's that whole thing. You've got to address the underlying cause of the hernia.
Right.
Too many people go, "Yay, I'm ready. Let's go."
Yeah.
No, not at all. And a lot of them will get operated 2 or 3 times.
Right. And I have a forum that I run called microdiscectomy. And a common theme is people living in constant fear after their surgery of reherniating or constant fear that life will never be the same again. Did your knowledge of functional medicine help you from stop you from going down that kind of mental
Definitely.
rabbit hole?
Definitely, yeah. And also the fact that I'd worked with that for years with hundreds and hundreds of patients. So firstly, I understand the fear
Mhm.
because you're literally in the worst pain, most limited state you've ever been in.
Yeah.
Everything hurts. Sleep, like I had no decent sleep for 2 months. My case in reality should have resulted in bowel, bladder, and sexual
Right.
function loss,
Yeah.
loss of those processes, and foot drop. That didn't happen. So I've seen much better cases, much
Mhm.
like less severe cases
Mhm.
where they're already losing bladder control and bowel control. So yeah, firstly, that helped a lot. The knowledge, knowing that, you know what, I've got this. I'm going to come back stronger.
Mhm.
And I did, because the exercises I learned after it have stabilized my spine. Remember, I suffered pain from 7 years of age.
Right.
So I was active and sporty. I just didn't know. We don't know how to look after our spine. We're not taught. The
Right.
dentists do a good job teaching us how to brush our teeth, and do regular checkups. But what do we do for our spine?
Yeah. And you have had no reherniations or, second surgeries since then?
No,
That's great.
no. That will
Long-term
not
success.
happen. That this is the thing. People have to truly believe that if they focus on the original cause and they rectify it.
Mhm.
Once again, the analogy with the car wheel, really important. You need to
Yeah.
go back. You need to find a chiro, physio, osteo, whoever you work with, to restore function.
Mhm.
Because there's a really good reason that disc is overloaded to the point of herniating or causing a protrusion.
Right.
So we have to go back and address that. Because if we just remove fragments, the same forces, abnormal forces, are acting on that disc.
Right.
That's really important. The other part was also the knowledge around, after that, to know what sort of exercises. What are the things that are kind to your spine that you need to promote?
Right.
What is not good for your spine that you need to avoid? And
Okay.
actually, I wrote my book on that,
Yeah.
and it was actually, I launched it after the surgery, funny enough, but I had been putting that together for years before because I was just frustrated treating the effect of
Right.
dysfunction instead of really people understand that they needed to focus on that well beforehand. So I truly believe most cases, unless it's a failure of the surgery,
Mhm.
will not need to do that. They don't have to have that fear if they look at those two really important factors.
That's great. So do you believe once someone has surgery, are they able to have a healthy spine again, or will it always be compromised?
100%. Okay. Now, when we say this, I'm referring to microdiscectomy, really
Right.
importantly, because
Right.
there's people that have, for example, surgery, fusion,
Fusions, yeah.
or a spondylolisthesis, let's say grade 3, and they can only bring that L5 back 50% of the way because
Right.
it might have been there years and decades. So could they expect to do the same things? Probably not.
Right.
I say that, and that's responsible advice to give. If it was me, I'd be striving always to do what I could because I've actually worked with athletes. There's an athlete years ago who had a spondylolisthesis and he had metal rods. I remember this. I saw the X-ray that
Mhm.
spanned the whole length of his lumbar spine. They wouldn't do that these days. It's just one segment.
Right.
And he got into yoga and became a professional surfer.
Wow.
Do you know what I mean? So
Yeah.
yes, you can. Where there's a will, there's a way. You just need everyone really has the responsibility of being empowered with the information
Right.
necessary to be able to look after themselves.
Right. That's great. Yeah, that's one of the reasons I do the podcast and the forum is just to get people thinking this is a challenge I can overcome. I won't be stuck like this forever. And just because I remember I went into the fear and the depression and it was terrible,
Yeah. No,
and
yes, honestly, congratulations for doing this because
oh, thank you.
people need it. And when you're in that situation, you don't know where to look, you don't know where to go.
Right.
You know, doctors are well-meaning and they're responsible. They've just got an allopathic paradigm.
Right.
It's very similar to calling who are you gonna call if your house catches fire? You're not gonna call the carpenter and the plumber, are you? You call the
Right.
fire brigade. But that's what they are, the fire brigade. They come and they put fires out. They look after pathologies.
Right.
However, within the paradigm of medicine, does not include rebuilding ever. And no doctor will tell you that. This is the thing. I think it's society, because we call it a health profession, it's actually a disease profession. But
Right.
because we call it a health profession, most of us go to a doctor expecting, oh, help us with our diet. What about this? Or, no, they understand health really well and how to suppress symptoms
Mhm.
and make the person feel better
Right.
without looking at the underlying cause. That's where we need to understand that. We need to complement that if we have surgery. But,
Right.
surgery, if anyone's thinking, maybe it's not surgical, what else can I do? It's such an anguishing time. It
Mhm.
really is. And actually, this is really interesting to say, Christine, that at the start of my career in Peru, I would have people come in and they would have heard about some Australian gringo and sometimes come from hundreds or thousands of kilometers away
Mhm.
and arrive, and I'd see their spines and I think, oh my God, like there's almost no disc space or there's phase 2 osteoarthritis or whatever. And I'm like, it's surgical. No, I'm not going to have surgery. I want you to. I'm like, I don't know. I'm pretty sure
Yeah.
it's surgical. Doesn't matter. So they obliged me at a young, early phase of my career to do
Yeah.
that. And that's when I actually learned that it wasn't me healing the person. It was actually the maneuver of restoring function again, combining chiro and physio and diet, because I'm really, really strong with all of those things
Right.
and the importance of all of them and more. Then, wow, the body can do amazing things. But I'm just asking everyone out there too, if they do that, never forget there's an underlying problem.
Right.
There's an underlying problem and it needs to be rectified and cared for regularly. If not, it will worsen with time.
And do you address this in your book?
Yeah, well, in my book's called The Secret of the Healthy Spine.
Mhm.
So basically, this book looks at causes of spinal problems, back pain, that traditionally aren't looked at. For example, emotional problems, chemical problems, meaning diet. So dehydration, those who smoke, sugar, trans fats, diet, toxins, all the rest, plus the effects of cortisol, that's when it's elevated
Mhm.
from stress, other problems as well, sleep problems, how they can all exacerbate underlying inflammation caused by the physical problem in the spine.
Right.
So, and the physical problems I just noted down for about 2 years, I guess. The list grew pretty fast, and then after 2 years, it stopped. So it's basically, I wanted to document all the causes of back pain that I could, because everyone that came in, I sat down and we identified the cause, whether it be sitting in a chair incorrectly or for prolonged periods of time or lying, sleeping face down, whatever it was, working, with the computer over here, watching television in bed, high heels and
Yeah.
more. So yeah, the work I'm doing now, okay, in my course, I've got an online course called the Strong Back Method. That's looking more at what you do, what exercises. Oh, if you're in pain and limited, what do you do? Oh, you're
Right.
out of limitation now. Okay, but still, sorry, you're out of pain, but you're still limited. Do these exercises. So I go a little bit deeper on that. And there's audio and videos. There's 90 videos. No, there's actually more than 100 videos. Some people have
Wow.
said the course is too long, but we need to learn,
Yeah.
to be able to look after ourselves, we need to learn the information.
Right. And I'm sure anyone who's in pain and finds your course is just eating it all up. So
Yeah,
really
it's
salty.
gratifying actually, because I
Yeah.
actually wrote it in Portuguese and Spanish first and then English only recently. So it was so gratifying receiving people from literally the other side of the country that
Wow.
bought my book and had to come to me, which probably
Yeah.
wasn't necessary, but the most important thing is that we have to look after ourselves. We can't put our health solely in the hands of somebody else.
Right.
Often my job's redirecting people to specialists in their area because physically I can't touch them. A lot of time I can't even examine them,
Right.
but they're patterns. We're all doing the same things incorrectly.
Right. So your book is good for people who haven't had surgery, but also recovering from surgery?
Both, yeah, for sure. Because
Yeah.
after surgery, you're going to want to know what
Yeah.
not to do. Yeah. And so that's very important. Plus, most people have never stopped to think of the importance of their diet or
Mhm.
their emotional side as well, like
Right.
sleep quality, stress, how they work. We talk about, for example, adaptogen herbs for the adrenals to
Right.
keep cortisol down and just diet.
Yeah.
That came from basically São Paulo. I was living there between Lima and São Paulo for 20 years. And I'd sometimes be palpating someone's spine. It'd feel like wood. And you're like, something else is going on,
Yeah.
and often with x-rays to show that there's nothing going, like there's no bony pathology.
Bone, yeah.
And you're like, okay, do you drink water? Oh, no, I don't like water. No, wouldn't you even do you drink water? So how much water do you drink a day? I don't drink water. I just drink, fizzy drinks. You're
Yeah.
like, what? So bit by bit, I managed to join the dots on the other things we're doing incorrectly.
Yeah.
We're able to really get people back better and stronger than ever. And that is
Yeah.
possible. That I'm driven by that because I know that was my case.
Right. I think a large portion of the population believes that all they have to do is get their core strong, like get strong abdominal muscles and their back is great.
Yeah, sure.
But
If
it's so much
only
more than that.
yeah, for sure. Like if you looked at, let's imagine the typical Western diet and junk food and
Mhm.
sugar that's maintaining your muscles, aided by cortisol being
Mhm.
high. your muscle's just in a state of reflex muscle guarding the whole time. Particularly the psoas muscle that spans the hip, okay, the top of the femur to the back. All the work in the world on that, all the work on core, all the treatment in the world will not even penetrate that problem without the person looking at. They might get relief, but we don't want relief. We want to know how to look after ourselves,
Right.
And we've got to honestly admit we're sicker and sicker. Our society is getting sicker and sicker. Sedentary lifestyle is another one. If you look at the spine was meant to move. It's a machine. No machine is ever happier not functioning. No car left in a garage is going to work better than a car that's being driven and maintained regularly. So exercise isn't an option. We're obliged to do it. It's like breathing oxygen.
Right.
It's that vital for spinal health and for health in general.
Now, I am interrupting your skiing trip for this podcast interview. So not only can you get your spine healthy after surgery, but you can get back to having an active and normal lifestyle.
As I say, with all the sincerity in the world, I'm 54. I feel better than what I did when I was 25, without a shadow of a doubt.
Wow.
And that's not just through spinal stuff. That's just health in general, just by following the rules.
Yeah.
And this is another thing. It's not daunting. If someone is overweight and they know that might be a factor, it's not rocket science. You've just got to be patient and believe in the inherent healing capacity of your body.
Right.
Do its trick, and it will do that. But of course, we also need to consider that it took a very long time, years or decades, to get to the hole that we're in. So it will take a little time to get out. But I'm doing everything now, and I'm not limited by anything at all. Not only that, I don't feel pain anymore, which is very different to those years before surgery, where I always did.
That's amazing.
Yeah, and that's predominantly, I guess surgery helped, but that was really only to correct that worn out tire. But it was also, I guess, the fact that I actually had to learn the correct strengthening exercises. So strengthening is a big part of it now. We can't expect to go and practice our favorite sport and not prepare for that.
Right.
I used to run a lot, and now I actually discourage people from running. I know a lot of people love running. I tell them, if you love running, go and sprint. It's just,
I hate it.
That's it. It's just long duration like that and a lot of impact.
The impact, yeah.
What about it? And this is the thing. Most people are betting on the fact that they've got an equal distribution of weight between left and right sides. Or in other words, their pelvis on an x-ray when they're standing is level at the iliac crest, and the femoral heads are even as well. Almost nobody has that.
Right.
So if you're not like that, it's like putting, let's say, 5 or 10% of the weight of a car on one wheel only. It's going to wear that tire out faster.
That's great. You gave me the perfect reason why I don't have to start running.
Exactly. What do you do, Christine? What sort of stuff?
I like to do dance workouts and also kickboxing, Les Mills, kickboxing.
Okay.
Those are the kind of workouts I like to do.
Yes, yeah. And what
some
about
weightlifting?
What about your regular care?
Oh, we don't need to get into that.
I'm totally interviewing you now.
Yeah. I actually try to eat whole food, plant-based, and no oil.
Okay. But I mean, spinal care as well. Like, have you got a practitioner you work with regularly?
I don't.
Okay.
And I've I had surgery and then have moved twice since surgery. But one of my biggest frustrations with getting surgery was you go, you see the surgeon, and then they let you go, and there's no kind of knowledge or education. It's just don't bend, lift, or twist, and have a good life.
Well, stay tuned. In the next month, I've got a course coming out for post-surgery.
Oh, great.
Yeah.
Where would they go if they wanted to find your course?
Online. It'll be online.
What's your site?
My site's actually my name, jasongilbert.com.au. And that's, if they're there, and it's a bit funny at the moment, it's going to be a week or 2 weeks until the new one's out. But I just feel the need to help people post-surgery. I was just in Hawaii. I work with the World Surfing League, 20 years with those guys. And one of our surfers, who is 62, had recently had a microdiscectomy, which is rare.
Wow.
Because after about 50, 55 years of age, all the disc is going to has dehydrated. So we were working on his back, and it's just really encouraging to work on him a few times manually and have him understand, oh my God, look at the improvement. He'd had surgery 3 months ago, but
Wow.
he was still limited. He wasn't surfing. And within literally 2 weeks of working on him, he's surfing again.
Yeah.
And so this is what I'm saying. It's not difficult. People have to believe. They just need to find the right people. If they don't gel with their professional,
Mm-hmm.
it's looking.
Yeah.
Yeah. But after surgery, look for someone who will regularly look after you.
Yeah.
You know, whether it's your chiropractor, your physio, that segment needs to be moved regularly.
I don't know how it is in Australia, but in the US, the doctors really vary on the need for physical therapy after surgery. So not all doctors even say go to a physical therapist. But it
Yeah.
sounds like to me you would say movement and exercise is a must.
Exactly.
Yeah.
Yeah, once again, we can't put all surgeries under the same umbrella, but these days, if it's a disc problem and
Mhm.
you're lucky it's a microdiscectomy, which is awesome. If there's some fusion involved, both surgeries I highly recommend. As soon as the scar tissue has
Mhm.
healed
Right.
and it's clean, work on it.
Yeah.
Get a deep soft tissue therapist to work through that. Okay,
Right.
really important that we don't allow that the scar tissue to form. We get some movement introduced there, basic walking. Okay,
Yeah.
as soon as you're allowed to walk, microdiscectomy the next day,
Right.
other fusions maybe up to a week. Walk, 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 walk. And at the right time, you've got to know what professional to introduce.
Yeah. What do you know the name of your post-surgery class that you will be putting online?
No, it'll be well, like my course is strong back, the strong back course. So I think it'll be strong back after surgery.
Okay.
Like I'm on my second book now is actually it's a longevity book. Okay, because
Okay.
I've also had mercury toxicity, which interestingly I think was responsible for blowing my disc out originally because it demineralized me. But yeah, I think it's going to be strong. Everyone wants to be stronger,
Right.
especially after surgery.
Yeah, definitely. Well, I think I better end this before you start asking me more questions about what I'm doing.
No, well, look, thank you very much for the opportunity. And look, Christine, I'm really accessible. So people can contact me, and many people do weekly on Instagram. And I
Okay.
always do my best to help them, to direct them towards the right thing.
Yeah.
It's so gratifying getting messages back thanking me. Oh, I went
Yeah.
to that physio, I went to that chiro,
Yeah.
so. And people don't have to suffer by themselves, but
Right.
sometimes they're just tired.
Right.
They've been everywhere and they just think there's no other option.
Right. And what is your Instagram? Is it also your name?
Yeah, my name is Jason Gilbert Official.
Official. Okay. Great. I'll make
Is it?
sure I'll put that up.
Okay.
Thank you, Jason,
You're
so
very
much
welcome.
for taking time out of your skiing trip to talk to us.
My
It's so
pleasure.
great yeah, to
I
have
love
people
talking
that
about my
just
passion.
provide hope. Yeah,
Yeah,
and you're
awesome.
clearly very passionate about it.
Thank you very much, Christine.
If you are a listener and you have a positive story of recovery from a serious back or neck injury, head over to bedbackbeyond.com and click share your story. I would love to add your voice to the Bed Back and Beyond podcast. Once again, Jason, thank you so much.
You're very welcome. Thanks, Christine.